Chapter 25, Legal Issues, Federal Regulations, and Accreditation. The United States healthcare system functions within the context of the legal system of the United States government. Healthcare and health informatics is heavily regulated by both federal and state governments. The federal government consists of three branches of government. It's the legislative, executive, and judicial. Each of these play a role in health IT laws and regulations. In addition to the laws and regulations, many healthcare systems must also meet accreditation requirements to be eligible for participation in healthcare programs that are administered by the government. The government of the United States functions as a federal system. There is a distribution of power between the federal government as well as the state and municipal governments. The United States Constitution is the supreme law of the land, and it defines the basic components of the three branches of government, and it sets forth the powers of each branch of government. The Constitution also provides the state governments with their governing authority. Laws that are passed through Congress are often written in broad terms and establish only general objectives that must be met. The rulemaking process begins with the drafting of a proposed rule. A key responsibility of health informaticians, either working through their own professional organization or as an individual, is to take an advantage of this opportunity to participate in rulemaking process. Any rules or laws that states pass must comply with the Constitution and be written within the scope of power that is granted to them by the Constitution. The final step of the healthcare regulatory process is enforcement. There are two possible mechanisms for regulatory enforcement. The first is through administrative agencies that promulgate the rules, the regulations. The second is through the court system. EHRs can make some clinical documentation easier for users, but the use of an EHR can lead to fraud and abuse claims by the federal government that may include large fines and jail time if the violations are proven. Chief among the potential pitfalls of this type of documentation are EHR purchase transactions, because these EHR systems are extremely expensive. The Stark Law governs physician self-referral for Medicare and Medicaid participants. This law generally prohibits a physician from referring patients for designed health services to entities with whom the physician has a financial relationship. The federal Anti-Kickback statute is a criminal statute that prohibits the exchange or offer to exchange anything of value in an effort to induce referral of a federal healthcare program beneficiary. Because this is a criminal statute, the government must prove its case in court beyond a reasonable doubt. There are common criteria that must be met to meet the safe harbor requirements under the anti-kickback law. Generally, these will include written and signed agreements are in effect for more than 1 year. Agreement specifies all the services, products, and space that is provided. The agreement specifies part-time intervals and changes. Payment is set in advance, is fair market value, and does not take into account the volume or value of any referrals. Agreement terms do not exceed commercially reasonable terms. And the agreement does not involve counseling or promotion of illegal activity. In 2006, a donation safe harbor exception was created that allows certain referring recipients to donate an electronic health record system to referral sources. It was designed to facilitate the physician adoption of electronic health record technology because many physician practices were unable to purchase and support technology due to the extremely high cost. The False Claims Act imposes civil liability on any person who submits a claim to the federal government that they know or should know to be false, and imposes certain monetary penalties for violations of the Act. The False Claims Act essentially prohibits fraudulent or false claims submitted to the government for payment, and also fraudulent or false claims that would decrease an amount owed to the government. Mail fraud includes healthcare fraud that occurs through the United States mail system or common delivery services, including FedEx and UPS. Mail fraud can occur when paper claims with improper coding are sent to patients or the insurance company. Improper computerized claim submissions may lead to charges of wire fraud. Healthcare fraud may include things as billing for services not rendered, billing for services that were unnecessary, or bundling services that are generally billed as one current procedural terminology code in order to increase revenue. One of the biggest fraud and abuse issues the government is targeting is within the electronic health record is the use of the copy and paste function. The Centers for Medicare and Medicaid Services published a toolkit that advises providers about methods and ways that they can ensure electronic health record fraud and abuse detection. When providers are billing their states through Medicaid, they also must be cognizant of their local laws related to fraud and abuse, and how these laws might impose either civil or criminal penalties on unwary healthcare providers. The Centers for Medicare and Medicaid Services has designated the Joint Commission and DNV as third-party agencies that are able to accredit hospitals for participation in Medicare and Medicaid programs. Both accreditation programs use the Medicare conditions of participation as baseline requirements so the hospitals can achieve accreditation. The goal of the Joint Commission's information management standards is to ensure that healthcare providers have a well-planned information management system that assists the practitioners with the provision of safe and high-quality care. The Joint Commission also issues Sentinel event alerts describing potential hazards to the quality of care and patient safety. The Joint Commission will identify actions that may serve to minimize the risk associated with those hazards. Currently, no one agency has the task of regulating health IT or applications. Regulatory authority is spread over agencies like the FDA, Food and Drug Administration, the FTC, Federal Trade Commission, state medical boards, the FCC, Federal Communications Commission, Centers for Medicare and Medicaid, and the Office of the National Coordinator, or the ONC, for Health IT. The FDA has authority over the Food, Drug, and Cosmetic Act. As the title of the Food, Drug, and Cosmetic Act suggests, The FDA generally has regulatory authority over foods, drugs, cosmetics, herbal supplements, and medical devices. These devices include certain health IT and embedded medical device software. The FDA is also tasked with assuring the safety and effectiveness of medical devices. The General Wellness Policy for Low-Risk Devices is guidance that has reaffirmed the idea that the FDA generally will not regulate wearable devices that are used for wellness under the FDCA. The FDA uses a two-part test in determining whether a wearable device is a low-risk general wellness product and not subject to regulation. One part is the project makes only general wellness claims. And the second part is the product does not present inherent risk to the user's safety. The privacy of health data that is collected by mHealth applications and wearable devices is also an issue. There is no healthcare specific federal prohibition on the collection, use, and disclosure of personal health information that is collected by any app. The majority of more than 165,000 available healthcare apps are generally not considered medical devices, and they are not regulated by any federal agency from a patient safety perspective. This may be considered problematic when there is an incorrect or grossly false information in the application, and the patient relies on this information instead of seeking professional medical advice and then suffers an injury. The role of social media in balancing the rights of the employees and free speech against the privacy rights of patients. More recently, the National Labor Relations Board made this balancing act more difficult by publishing the model social media policies for employers. This might, if enforced, effectively prohibit employers from implementing social media policies that protect patient privacy. The healthcare system in the United States is extremely regulated, and these regulations have a significant impact on the practice of health informatics. Health professionals, health informaticians, the providers that they serve, and the patients who depend on health care system must understand and utilize the regulatory framework that is associated with health IT and informatics. Health informaticians must become proactive as the law and regulators are struggling to catch up with health technology related innovations, as well as providers and patients' reliance on these new technologies and devices.